Welcome to Radiology Made Easy. Today, I'm reviewing selected images from a CT scan, focusing on the lumbar spine. On these scans, I see a well-defined lytic lesion located in the left pedicle and left side of the vertebral body of L3. The lesion appears to have breached the cortical margins of the spinal canal over a short segment, as observed on the axial images. Interestingly, I can't identify any additional lesions on these images, which suggests a solitary nature. In the final image, there's a CT-guided percutaneous intervention, possibly a biopsy, being performed. I can see the tip of a needle lying within the lesion, which indicates the process of obtaining a tissue sample for further diagnostic clarity. When considering a differential diagnosis for such a lesion, it's crucial to take into account the patient's age and medical history. If there's a history of a primary malignancy elsewhere, that increases the likelihood of a metastatic lesion. Given the degenerative changes visible elsewhere in the spine, I suspect the patient is middle-aged or older. In such cases, a metastasis, myeloma, or lymphoma is more likely than a primary bone lesion. For solitary spinal bone lesions, there are several key considerations. It's important to consider non-neoplastic causes like hemangiomas, which are common incidental findings. These have a characteristic pepper pot appearance on axial images or a corduroy pattern on longitudinal images. Other possibilities include infection, Paget's disease, and various inflammatory conditions, such as Sappho syndrome, which involves synovitis, acne, pustulosis, hyperostosis, and osteitis. The location of the lesion within the vertebra is also significant. Lesions in the vertebral body often include leukemia, lymphoma, myeloma, metastasis, and eosinophilic granuloma. Giant cell tumors generally occur in the posterior elements. Aneurysmal bone cysts, hemangiomas, and osteoid osteomas or osteoblastomas may also be found in these regions. Age is another crucial factor. Primary vertebral tumors are rare in older patients, but more common in children and younger adults. For instance, the most common primary vertebral tumors in children include osteoid osteoma, osteoblastoma, aneurysmal bone cyst, and rarely Ewing sarcoma. Eosinophilic granulomas, although usually benign in younger patients, may indicate a malignant process like myeloma or metastasis in adults. In this case, the lesion's appearance and the patient's likely age suggest myeloma, particularly solitary myeloma of bone, also known as plasmacytoma. This condition often precedes multiple myeloma by up to 2 decades. While myeloma most commonly affects the spine, especially the thoracolumbar region, it can also occur in other locations, such as the ribs, pelvis, and skull. The imaging appearance of myeloma can vary, sometimes presenting as an expansile osteolytic lesion, which might mimic metastatic renal cell carcinoma or benign etiologies. In some cases, sclerotic forms of the disease are also possible. Thank you for watching Radiology Made Easy. Remember, every image tells a story, and I'm here to help you decode it. Please share your thoughts and suggestions in the comments below, and stay tuned for more insightful discussions. See you next time.